Hello, welcome back to this channel. Today, the topic of our video is penicillin, that is an important antibiotic and drug in pharmacology. So, if you want to learn all about penicillin, watch this video completely to clear all your concepts. So, this slide shows the mechanism of action of various antibiotics according to the location of cell of bacteria where they act. So first class is cell wall inhibitors that include beta-lactams, vancomycin and bacitracin. Penicillin lies in this beta-lactam group. Next is plasma membrane inhibitors that include polymyxins and daptomycin. Other group include there are some drugs that inhibit the metabolic pathways undergoing in the cytoplasm of bacteria that include folic acid synthesis inhibitors and mycolic acid synthesis inhibitors. Various drugs also inhibit ribosomes in the cytoplasm of bacteria. They can inhibit 30S subunit of ribosome that include aminoglycoside tetracyclines, and 50S subunit inhibitors include macrolides, lincosamides, chloramphenicol. And last group that inhibit the genetic material of bacteria, they include DNA synthesis inhibitors, fluoroquinolones, and RNA synthesis inhibitors include rifampicins. So first group of antibiotic is cell wall synthesis inhibitors. For understanding this cell wall synthesis inhibitor, we must first know the structure of cell wall of bacteria, that is composed of a polymer called peptidoglycan. Peptidoglycan basically consists of glycan sugar units that are attached to each other by peptides cross links. This group effects on proliferating phase of microorganisms only when the bacteria is dividing or growing. Otherwise, it will not affect bacteria. Most important member of this group include beta-lactam drugs and vancomycin. This figure shows the structure of peptidoglycan that include these glycine units. They are NAM and NAG, two sugar units. They are attached to each other, and then this two subunit of sugar is attached by a peptide crosslink, that is pentaglycine crosslink. This is a peptidoglycan monomer that include these two sugar units and one peptide chain, and all these are joined together to form a peptidoglycan chain. So after discussing the various mechanism of actions of antibiotics and cell wall structure, now we will discuss penicillin in detail. Penicillin is basically the first antibiotic that was ever extracted from a mold that is called Penicillium notatum. Penicillin is basically the widely effective and least toxic drug known, but its resistance has increased very much. There are various members of this penicillin family that differ from each other by an R substitute that is attached to 6-amino penicillinic acid residue. The various properties of this penicillin drug would affect on this R substitute, whether this type of penicillin is stable to stomach acid or not, whether it's cross hypersensitive or not, whether it is susceptible to bacterial degrading enzymes called beta lactamases or not. These whole properties would depend upon the R substitute that is attached to the nucleus or 6-amino penicillinic acid residue. Natural penicillins include benzyl penicillin or penicillin G, that was the first natural penicillin available. Then other natural penicillins include phenoxymethyl penicillin or penicillin V and phenythicillin. All these penicillins include, as we have discussed earlier, a penicillin nucleus that is 6-amino penicillinic acid to which R substitute is attached. This nucleus consists of four-member beta-lactam ring that is fused with a thiazolidine ring. This beta-lactam carry a secondary amino group where acidic radicals can be attached to amino group. Then they can be produce various semi-synthetic penicillins. This picture shows the structure of penicillin that include a four-membered beta-lactam ring, and this is the R substitute where any amino secondary radical is attached, thus producing different various forms of penicillin. These are two natural penicillins that include penicillin G and penicillin V, and when a secondary amino group is attached, they would produce other synthetic forms of penicillin that include ampicillin, amoxicillin, and methicillin. So members of penicillin include amoxicillin, ampicillin, diloxacillin, indanyl carboxylene, nafcillin, oxacillin, penicillin G, penicillin V, piperacillin, and ticarcillin. So classification of penicillin include natural, anti-staphylococcal, extended or broad spectrum, and beta-lactamase inhibitors. Natural penicillins include penicillin G and V as we have discussed earlier. Anti-staphylococcal include methicillin, oxacillin, nafcillin, and extended or broad spectrum penicillins include amoxicillin, ampicillin, carboxylene. Beta-lactamase inhibitors include clavulanic acid, sulbactam, and tazobactam. Beta-lactamase is an enzyme that is produced by bacteria to inhibit or degrade beta-lactam ring of penicillin, and thus inhibiting the action of penicillins against bacteria. So these drugs inhibit this enzyme produced by bacteria and cause the penicillins to be effective. Broad spectrum penicillin combinations include combination of amoxicillin with clavulanic acid, ampicillin with flucloxazoline, ampicillin with sulbactam, ticarcillin with clavulanic acid. The importance of this combination is that this is a combination of penicillin with beta lactamase inhibitor. This beta lactamase inhibitor drug would inhibit the action of beta lactamase and would render this penicillin to be effective against bacteria. Anti-pseudomonal penicillins are the penicillins that are effective against Pseudomonas aeruginosa and various other gram-negative bacteria. These include carbanicillin, ticarcillin, and piperacillin. So what is the mechanism of action of penicillin? Penicillins are basically bactericidal. That means they would inhibit the growth of bacteria. By inhibiting the growth of or cell wall synthesis of bacteria, they would inhibit the last step in cell wall synthesis, that is transpeptidation or cross-linking formation. So when the cell wall synthesis is inhibited, bacteria would be devoid of cell wall or they would be osmotically less stable, and then the cell lysis of bacteria would occur either through osmotic pressure or by activation of autolysin. The mechanism of action of penicillin on bacteria would depend upon its antibiotic size, charge, and hydrophobicity. As we have discussed earlier, penicillin would effect only on the proliferating microorganism when the cell bacteria are in the proliferating phase or growing phase, because they inhibit the cell wall synthesis step. So it would not be effective against microorganisms that are devoid of cell wall, that include mycobacteria, protozoa, fungi, and viruses. So penicillin undergo its mechanism of action by penicillin binding proteins, inhibition of transpeptidase, and production of autolysin. Penicillin binding proteins are basically the bacterial enzymes that are involved in synthesis of cell wall and maintain the morphological features of bacteria. When these antibiotics are exposed to these penicillin binding proteins, they would prevent cell wall synthesis and also lead to morphological changes that would cause the lysis of susceptible bacteria. The number of these penicillin binding proteins varies with the type of organism. So when these target molecules are altered, they can cause the resistance of bacteria. For example, methicillin resistant Staph aureus is produced by this alteration of the penicillin binding proteins. Next mechanism by which penicillins act are inhibition of transpeptidase enzyme, that is an important enzyme in formation of cross-linking of the cell wall of bacteria. So when this enzyme is inhibited, there is no cross-link formation and no cell wall formation of bacteria. Autolysin is an important degradative enzyme that is produced by many gram-positive bacteria that undergo normal remodeling of bacterial cell wall. When there is penicillin, this degradative action of autolysin undergo even in the absence of cell wall synthesis. So penicillin has its antibacterial effect both by inhibition of cell wall synthesis and also by destruction of existing cell wall by autolysin enzyme. So transpeptidase is an enzyme that would cause the formation of cross-linking between these peptidoglycan monomers, and it would form a peptidoglycan chain. When the penicillin is present, it would inhibit this peptidase enzyme, and there would be no cross-linking formation of peptidoglycan and no cell wall formation. So this widely used antibiotic has undergone so much resistance worldwide, so we must know the various mechanisms of resistance of this drug. Natural resistance comes when in microorganisms who do not have any cell wall. As we have discussed earlier, this drug would only affect to microorganisms who have cell wall or would be in proliferating phase. So it would not be effective in cell wall lacking bacteria, for example mycoplasma. Next mechanism of resistance include beta-lactamase activity. Beta-lactamase is an important enzyme that is produced by bacteria that that hydrolyzes this beta-lactam ring of penicillin, so rendering its bactericidal activity. Next mechanism of resistance include decreased permeability of drug and decreased penetration of antibiotic through cell membrane that would prevent this drug from reaching to target penicillin binding proteins. And other mechanism include presence of efflux pump that would reduce the amount of intracellular penicillin by causing its efflux out of the cell. And last mechanism of resistance include alteration in penicillin binding proteins, that is an important mechanism of action of penicillin. Then this altered or modified penicillin binding proteins would have a lower affinity for beta lactam antibiotics and then inhibiting their action. Pharmacokinetics of this important drug include: first step is absorption. The route of absorption of this drug, as of other drugs, would depend upon the stability of drug to gastric acid and by the severity of infection. For example, carbanicillin and ticarcillin would not be absorbed after oral administration. Benzylpenicillin, ampicillin and clozacillin would be moderately absorbed after oral administration, and phenoxymethylpenicillin, amoxicillin, becampicillin, talampicillin, flucloxacillin and ciclacillin would be well absorbed after oral administration. So after absorption, next step is distribution. Penicillin would then be widely distributed in body tissues. It is not entered in CNS, so in case of meningitis, we would have to give large doses of IV oxacillin and dicloxacillin. Excretion of penicillin, mostly absorbed penicillin would be rapidly excreted by kidneys into urine. About 10% of renal excretion would be by glomerular filtration and 90% by tubular secretion. Ampicillin is excreted more slowly than penicillin G. Naphthalene is excreted 80% into biliary tract and only 20% by tubular secretion. Penicillin is apart from urine, it is also excreted in sputum and milk, and dose modification would also be needed for severe renal failures. So what are the adverse effects of penicillin? As we have discussed earlier, it is least toxic or safe drug to use. The only adverse effects include allergic reactions that can be mild to severe. The major determinant of penicillin hypersensitivity is penicillinic acid that would react with protein, and this combination would serve as heptan and would induce immune reaction. Other non-allergic adverse effects include diarrhea due to alteration in normal intestinal flora, sometimes hemolytic thrombocytopenic or interstitial nephritis, and it would cause unexpected source of sodium or potassium, so it must be used cautiously in case of cardiac patients. Neurotoxicity including convulsions if injected intrathecally, and decreased coagulation with high doses of piperacillin, ticarcillin and naphthalene. Thank you for watching this video. Stay tuned and subscribe to our channel for watching more informative videos related to different topics of medicine.